Hi, everybody. This is Dr. Daniel, and today I'll be podcasting on a subject called List of Common Migraine Triggers. Migraine is a genetic condition that's inherited through your DNA, and the genes that transmit migraine have been found and published in the medical literature. Migraine occurs in 25% of women and 6% of men. For women, migraine is their most chronic common medical problem, more prevalent than diabetes, heart disease, or arthritis. Migraine is one of the main causes of disability worldwide in men and women. Migraine causes more than 1 million ER visits every year. Attack of migraine lasts 4 to 72 hours and may be called episodic migraine if it occurs less than 14 days per month, or chronic migraine if more than 15 headache days a month occur, 8 of which have migraine features. Researchers have discovered so-called migraine triggers, which may set off an attack within 24 hours. Aggravating features are more chronic occurring factors lasting weeks to months that may set off a migraine headache. List of common migraine triggers. So I'm just going to read you this list, and later I'll come back and talk about it in more detail. Stress, nervous excitement, freedom from stress, the letdown weekend holiday headache, menstruation with fluctuating estrogen levels, elevated estrogen level from birth control pill or treatment of postmenopausal women, hypoglycemia from fasting, barometric pressure weather change, motion sickness, mountain sickness / decompression illness, insomnia, oversleeping or napping, nocturnal end of a dream headache, fragrances, flashing, flickering, or fluorescent light, dietary factors, heat, sun, workout headache, intercourse or orgasm headache, overuse of analgesics, head injury, concussion, post-concussion, fever, caffeine withdrawal, wine, beer, alcohol, hangover headache, brain freeze or ice cream headache, toothache or grinding with TMJ syndrome headache, prolonged overexertion. Okay, so next I'm going to discuss the individual issues. Let's start with stress or nervous excitement. Stress is always the number one driver of migraine, and stress is outside pressure in life, work, or family that's upsetting. Humans use mental mechanisms of denial, projection, and suppression to deal with unsettling situations. It could be working 2 extra hours a day, caring for a sick child or a family member, inter-office conflict, monetary pressure, an overbearing, critical boss, or many other things. Whatever it may be, the stressful event occupies our minds, and if unhealthy, we brood or bury it and don't talk about it. If we are healthier, we discuss the problem with our spouse, friend, family member, priest, rabbi, or preacher. We get it out and deal with it. Then we feel better. We find a way to make it through. Stress can cause acute nervous excitement, sometimes with symptoms from altered normal physiology of our bodies, like the rapid heartbeat, trembling hands, and trouble breathing symptoms that may come with a panic attack. Whatever the stress is, it can set off migraine headaches. Next, freedom from stress, letdown, weekend, holiday headaches. Some people reliably get a migraine not at the time of stress, but when they're free of stress. Example for this may be the letdown headache that occurs after completing exams at school, or a mother who finally finishes everything she must do on Thanksgiving to prepare the turkey, and picks up her home for 14 members. She sits down, puts her feet up, and soon an awful migraine starts in her left temple. Part of this may be withdrawal from the constant vasoconstrictive effect of the stress hormone adrenaline, and contracted arteries are suddenly released into vasodilatation, and a severe migraine starts. Actually, the neurophysiology there may be more complicated, but that's a simple way of explaining it. Menstruation with fluctuating estrogen levels. Living, Living, the great British cataloger and writer of migraine in the late 18th century, described catamenial, which is menstrual-related migraine. That's spelled Catamenal. He did that in 1873. And it's known that about 60 to 70% of women with migraine develop a migraine around the end of the third week of their menstrual cycle when estrogen levels fall. This is called menstrually related migraine without aura. 30% of women have no menstrual cycle-related migraine. Also, the first 6 months of pregnancy are a high estrogen time for mothers, and migraines rarely come then. The types of migraine that occur here are pure menstrual migraine, where the woman only has migraine headaches during her cycle and at no other times, or menstrually-related migraine with or without aura, where migraines occur during the cycle time and at other times during the month. It's not well understood exactly how falling levels of estrogen produce migraine. Elevated estrogen level from birth control pill are treatment of postmenopausal women. The FDA has warned that all estrogen-based birth control pills are contraindicated with migraine. This means that they shouldn't be taken by migraineurs. Also, postmenopausal women may develop more frequent and severe migraines taking estrogen. Women with migraine with aura carry a 6% risk of stroke, which can be increased up to 3 times that by taking the birth control pill or using an estrogen-based birth device. The general rule here is that both fluctuating levels of estrogen, such as occur with a normal menstrual cycle of 3 weeks of estrogen and then a week of progesterone, or estrogen levels that are too high may worsen migraine. Hypoglycemia from fasting. It's well accepted that fasting can produce a migraine attack in persons with migraine. Living, again, described fasting as an aggravating factor for migraine in 1873. Everybody gets hypoglycemia if they don't eat. Your car won't go if it doesn't have any gas either. Breakfast means break the fasting of sleep. Migraine patients should eat 3 meals a day and carry extra snacks or power bars if they get hungry. And I saw innumerable women with migraine in my career who would give their children or their family 3 meals a day, but they wouldn't do it themselves. They wouldn't eat breakfast. Barometric pressure change. Migraine patients commonly report when seen back on regular visits about the effect of weather change or cold fronts on or barometric pressure aggravating their headaches. I hear it all the time. It's like persons say they can feel a storm coming in their bones. Living reported the influence of the atmosphere on migraine in his book on migraine in 1873. It may be due to the pressure difference between the atmosphere and air-filled sinuses. I never really learned about barometric pressure sensors in the brain when studying neuroanatomy, and some say the reaction comes from the sensors in carotid arteries or traction on cranial or dural veins or cranial sinuses that occur with barometric pressure change, but it certainly sets it off. And it also happens with these other features that are called mountain sickness, scuba diving, high altitude jet travel, decompression illness, altitude changes, and with dry wind sweeping down the mountains. A study in the Journal of Internal Medicine article reported on migraine patients who kept a headache diary for 1 year. After comparing these diaries with the barometric pressure changes noted at a nearby weather station, a direct correlation between lower atmospheric pressure and the onset of duration of migraine attacks was found, and the report concluded that, open quote, barometric pressure change can be one of the exacerbating factors of migraine headaches, period, end of quote. Prince et al., writing in 2004 in the journal Headache on the effect of weather on headache on 77 patients in a migraine clinic. They found that 39 or 5.6% were found to be sensitive to weather, but 48 or 62% thought they were sensitive. The authors concluded, our study supports the influence of weather variables on headache. We show that patients are susceptible to multiple weather variables and that more patients thought weather was a trigger than was the case. I've always instructed patients to monitor barometric pressure daily on their cell phones or a computer, and if they get a barometric pressure headache, to treat early with a triptan even before the migraine starts. Motion sickness. Motion sickness is comorbid, 60% with migraine. Motion sickness is car sickness when a child unable to read in the car, especially the back seat, are people who get air sickness or seasickness. Migraine inflames all the sensory cranial nerves, and the eighth cranial nerve carries audition, and motion sensitivity from the inner ear into the brain. The migraine process inflames this nerve. Many patients with acute migraine get car sick when driving, which may not bother them when they don't have a migraine headache. A new classification of migraine from the International Classification of Headache Disorders is vestibular migraine. This may be attacks of vertigo with or without migraine headache at the same time that comes with nausea, vomiting, and prostration. The word vertigo comes from the Latin meaning to turn or spin. In its broadest application, vertigo may mean perception of movement of their environment by an affected person. As an ex-Navy neurologist, that's me, I know that the U.S. Navy has a medical restriction regarding motion sickness that may drive an unfortunate, promising, and willing recruit to a medical board for dismissal. Reason would imply that motion sickness is potentially a medical limiting problem for any sailor. And I remember a guy who was from the Midwest. I was stationed in San Diego, had taken off to go to the Western Pacific. That's called Westpac in Navy talk. And he got about halfway there, and he was on a submarine. He got so sick they had to air vac him back to San Diego, and then his admiral had him released out of the Navy because he had motion sickness. All right. Migraine patients get motion sickness more than the normal population, and the existence of motion sickness is often queried on headache history inventories in the office of a neurologist or headache doctor. Patients with motion sickness report symptoms also at the fair, on whirling rides or roller coasters. Sometimes the motion-induced vertigo and nausea. After that, the patient with motion sickness will get a headache as the migraine may be activated by the vertigo. Gradually, they learn to avoid such rides. They know they can't read in the car, and it's better to drive or sit in the front seat, and with time, they adjust to the problem. Insomnia. Poor sleeping habits have a powerful effect on migraine headaches. Insomnia is a core diagnostic feature of depression, which is 50% comorbid with migraine, and with generalized anxiety disorder, GAD, which is 40% comorbid with migraine. Using electroencephalogram, or EEG, sleep has 4 stages, with stage 1 being light sleep and stage 4 being deep sleep. All the sleep studies on migraine patients find they only get to light stage 1 or 2 sleep. Trouble sleeping could be taking a long time to fall asleep, or trouble staying asleep, or sometimes both problems. Then during dreaming, rapid eye movement, or REM sleep occurs, and migraine patients may experience an end-of-the-dream wake-up migraine headache. Migraine patients also may have early morning wake-up headaches. Oversleeping on a non-working Saturday or Sunday morning may also trigger a migraine. Fragrances. Migraine inflames all the brain's sensory nerves, and the olfactory nerve is the first of the 12 cranial nerves. The odors or fragrances that aggravate migraine are cigarette or cigar smoke, perfumes, paint, and mildew. This is called osmophobia. Migraine patients have sensitive brains. Kelman in Headache wrote on osmophobia and taste abnormality in a large 727 group of migraine patients, and Kelman reported, quote, osmophobia and taste abnormality occur in 1/4 of migraineurs during an acute migraine attack, while perfume or odor trigger migraine in almost 50% of patients. Osmophobia and taste abnormality in the acute migraine attack, as well as perfumes or odor as a migraine trigger, are more common in females than in men. Flashing, flickering, or fluorescent light. Sensitivity to light or photophobia is one of the necessary diagnostic features of migraine, according to the International Classification of Headache Disorders. Many different types of light may aggravate the sensitive brain of a migraine patient. Patients may state that they've experienced the start of a migraine after seeing light glance off the shiny chrome of a car or water. Others may state that their migraine started after watching the sun shine through lines of trees while driving. Migraine patients who go to bars where there's loud rock music and flashing strobe lights may get a headache. Fluorescent lights will flicker when they're turned on, particularly if they're old or if they need to be replaced. If this light is located in the workplace, it may aggravate certain sensitive migraine patients. I have written notes for patients to give to their boss requesting these fluorescent lights to be replaced. I've also had patients who wore dark glasses at work because they couldn't get the light changed. Many migraine patients wear hats with bills or sunglasses when outside. They avoid the light. Fever. Someone with fever has a flushed red face. In this condition, all the superficial arteries in the skin of the face are vasodilated. During an attack of migraine, the cranial nerves are also vasodilated. Persons without migraine may get a vasodilating headache with fever, but migraine patients are more commonly affected. Dietary factors. This is a complicated, controversial subject in the migraine literature that's not really well worked out yet. I have a list of possible foods that may aggravate migraine on my webpage, drmigraine.com, under the general migraine category, and a chapter about that in my migraine book called Migraine Aggravating Events. The usual foods discussed are hot dogs, foods with monosodium glutamate, which is MSG, chocolate, and yellow cheeses. Heat, sun, workout, headache. The relationship of heat, sun, and working out with migraine has not been studied statistically, but mostly surveys of migraine patients mention it. None of the headache textbooks I consulted discussed it, but it's all over the internet. If one Googles migraine and heat or migraine in the sun, consider that exposure to heat, sun, or working out makes the individual's face red or somewhat flushed, and all the tiny blood vessels in the face are vasodilated following exposure to heat, the sun, or working out. And the same thing happens inside the skull to the cerebral arteries. Cerebral vasodilatation and trigeminal activation are the heart of migraine and clues to our understanding of what's going on in the brain with headache. There may be more subtle changes in the brain from small increases in core body temperature, which also promotes migraine. Intercourse orgasm. The occurrence of a sudden, quick, high-intensity onset to peak level 10 headache with orgasm is a well-known and reported occurrence with migraine. These headaches have been described as, quote, they come on in seconds, like a flash, like a bolt from the blue, like I was hit on the head with a hammer, end of quote. After neurologic workup, these headaches are usually considered benign. Hippocrates described headache from immoderate venery, and venery is excessive sexual activity. Napoleon's wife reportedly stated, quote, not tonight, I have a headache, end of quote. And this is a common, somewhat humorous cliche reflecting the socially assumed but inaccurate gender differences in sex drive and the perceived role of women regarding controlling and sometimes avoiding sexual activity which exists in modern culture. Lance, a famous Australian headache neurologist, first wrote about it in 1969 in his article entitled Coital Cephalgia. Lance later stated, open quote, since foods and wines are often incriminated as sources of headaches, it seemed only a matter of time before sexual intercourse was added to the list of pleasurable activities which may be responsible for headache, the most common of killjoys, end of quote. However, Couch and Bears reported in 1987 that some individuals have noted relief from migraine and headache with sexual activity and orgasm, so go figure. For the thorough discussion of this, go to chapter 12 in my book on migraine. International Classification of Headache calls this primary headache associated with sexual activity. Overuse of analgesics. This is the most common reason for a headache patient to see a headache doctor, medication overuse headache. The syndrome was first called rebound headache, indicating return of headache after initial successful treatment. This is now called medication overuse headache and affects 3 to 4% of the world population. The International Classification of Headache Disorders says that taking over-the-counter drugs such as caffeine, Tylenol, Advil, or naproxen over 15 days a month, or triptans, opioid narcotics, or butalbital more than 10 days a month may produce medication overuse headache. See Chapter 5 in Migraine for a more thorough discussion of that. Head injury, concussion, post-concussion. All of the following entities may worsen migraine. A mild, non-concussive head injury causes headache sometimes for several days. Concussion may cause headache for weeks to a month, and post-concussion syndrome for several months. But none of the injuries cause headache every day for a long time, like a year, without the patient over-treating with medication. The doctor and the patient must be careful with the judicious use of treatment for a headache in this situation. Opioid narcotics and butalbital have no place here. Caution also with the use of over-the-counter drugs like caffeine, Tylenol, Advil, or Aleve, because they can also produce daily medication overuse headache. In general, patients with head injuries should be scanned at the ER with CT and be examined by a doctor. And head injuries may release neurochemicals in the brain that aggravate headache. There's a head injury migraine syndrome called post-traumatic migraine also. Caffeine withdrawal. Caffeine is the most commonly used over-the-counter vasoactive drug in the world used to treat headache. The popular soft drink Coca-Cola was invented by a pharmacist for the purpose of treating migraine headache. He sold that in drugstores. Caffeine has been combined with aspirin as Excedrin for treatment of migraine. It's all that a number of mild migraine patients need to get rid of their headache. In recent years, the Starbucks chain has placed their ubiquitous logo and coffee houses all over America selling a very high caffeine content of coffee, which has moved the American caffeine addiction problem to higher levels. When a patient sits down across me in my office and I see they're drinking one of the Starbucks 550 milligram lattes of coffee, I know I've got somebody probably taking too much caffeine when I start talking to them. Medical articles declaring addiction to caffeine and predictable withdrawal symptoms following cessation occurred in the early 1990s and probably influenced the inclusion of caffeine as an addictive drug in the 1994 edition of the DSM-4, which is the American Psychiatry Association Fourth Diagnostic and Statistical Manual. Pharmacologically, caffeine acts as a CNS stimulator, a point is made well by the coffee ad on TV, which calls it the think drink. The duration of the effect of the drug is 4 to 6 hours. This means if one goes to bed at 11 p.m., then the last drink of coffee should be no later than 3 p.m. so that caffeine doesn't affect sleep, although many persons will sleep better with no caffeine at all. Caffeine acts as a constrictor of the smooth muscle found in arteries, the bladder, and the colon. It's the arterial vasoconstriction action of Excedrin which helps mild migraine, but may lead to medication overuse headache when one withdraws after taking too much caffeine. The smooth muscle effect also acts as a mild stimulant on the bladder, promoting urination, and on the colon, producing a bowel movement. Withdrawal caffeine symptoms are headache, fatigue, restlessness, nervousness, insomnia, exhaustion, and psychomotor agitation. That may last several weeks. I have a web-page article on caffeine as a drug and how does caffeine worsen migraine on my migraine blog at drmigraine.com. Wine, beer, alcohol, hangover headaches. Paulus Aegletia in the 7th century described migraine from drinking of wine. Gallagher, writing in Headache in 1988 on diet and migraine, stated, alcohol is a non-specific vasodilator that is thought to provoke migraine attacks in susceptible persons by depressing or altering the function of the central vasomotor centers, since the direct effect of alcohol on blood vessels is insignificant. Of all the known precipitating agents, alcohol is the most consistent provoker of headache than the largest number of migraine patients. As time has gone on and more research has been done, the relationship of alcohol to headache has become much more complicated. We need good studies here. Alcohol may cause immediate headache, like 30 minutes after drinking a glass of red wine, or delayed headache called a hangover. It comes on the next morning. That can happen in normal people who don't have migraine, but it's worse in migraine patients. Some persons drink to excess to have a next morning hangover, while the migraine patient may awaken with headache following only a small amount of alcohol. I have an article there on Is Alcohol a Migraine Trigger at my blog. Brain freeze, ice cream headache. Raskin wrote that the most common cause of headache pain is ice cream, occurring in 1/3 of a randomly selected population. And most people are familiar with this problem. They eat something very cold, and when that cold substance touches the roof of their palate, many times, and very soon, they experience an intense, dagger-like pain extending from the palate and the throat through their head that stops them from doing anything for a few moments. Houlihan, in his 1997 British Medical Journal editorial in 97, entitled Ice Cream Headache, No Need for Abstinence, described the problem as follows, quote, the pain begins a few seconds after the rapid ingestion of cold foods or beverages and peaks in 30 to 60 seconds. The pain is usually located in the midfrontal area, but can be unilateral in the temporal frontal or retroorbital region. It is a stabbing or aching type of pain that recedes 10 to 20 seconds after onset. Rarely it proceeds for 2 to 5 minutes. The cold substance, which could be Rocky Road ice cream or a 7-Eleven slushie, provokes the sensitive temperature fibers of the second maxillary division of the trigeminal nerve and the glossopharyngeal nerve in the throat, so that certain persons develop this predictable, short-lived, but disturbing experience. Pain and temperature fibers travel together through the same neuronal pathway, and then cold can become pain very quickly. The question is whether many normal non-migraineurs get brain freeze headache or if it's a specific migraine trigger. As with many modern myths that are carefully studied, the devil is in the statistic. My migraine book has more to say about this. So no treatment is usually required, and sufferers rarely seek medical attention. Since the posterior aspect of the palate is most likely to produce the referred pain of ice cream headache, avoiding contact of cold food with this area can effectively eliminate the symptoms. Most people arrive at such preventive measures without the advice of doctors, and avoiding ice cream is not indicated. Who wants that? Toothache, grinding with TMJ syndrome. All teeth and the temporomandibular joint, the TMJ, are innervated by the trigeminal nerve, and pain from dental or joint disease can aggravate brain pathways that lead to migraine. Prolonged overexertion. Overexertion turns on the autonomic nervous system and the pituitary adrenal system, much like stress or the fight or flight response. Cerebral neurochemicals are produced also. The problem for the patient is that their bodies do all these things naturally and without their will, so that when the exertion is over, the patient collapses and tries to get some rest. Subsequent withdrawal of adrenaline or cerebral neurochemicals can produce a letdown headache at a time of rest following exertion. This may be the weekend, a vacation to the beach, the end of school and the kids are out, or the downside migraine attack that follows a major national or religious holiday. Related question. Which on the list of triggers, which are triggers and which are aggravating factors? It depends on time and which ones result in a migraine within 24 hours or following an accumulation of problems. So triggers would be short-acting things 24 hours, so like menstruation, hypoglycemia, barometric weather change, motion sickness, mountain sickness, oversleeping, end of a dream, fragrances, flashing light, dietary factors, heat, orgasm, head injury, fever, caffeine withdrawal, alcohol, brain freeze, and toothache. Aggravating factors would be stress, freedom from stress, elevated estrogen, insomnia, overuse of analgesics, and exertion. All right, so thank you very much for listening to this. Please click on like down there and subscribe, and follow me on podcasts that I have on migraine. And I will see you on the next talk.